Hello, everyone. This is Barbara C. Phillips, founder of Nurse Practitioner Business Center, the Clinician Business Institute, and the NP Business Matters podcast. Today, I'm sharing right here on YouTube a recent podcast episode that I did with Katy Searle, who owns the Firth Medical Center in Firth, Idaho. She shares with us the early days of when she was still an employee and when they wanted to shut it down and she wanted to purchase it and what took place. She was actually able to take this practice that they thought would go nowhere and turn it into a very successful practice, eventually bringing on a couple of other nurse practitioners who were former students and one who will be the new owner of this clinic someday. Now, if you'd prefer the audio version of this podcast, just the audio version, along with all of our other previous episodes, then you can pick that up at any place that you listen to podcasts or over on our blog at npbusiness.com. And if you like seeing the video of the podcast and want to see more like this and other content that is related to the business of being a nurse practitioner, please help me with the YouTube algorithm and like, subscribe, and ring that notification bell. Post your thoughts in the comments below because I really do read them. Now, let's go ahead and get started with Katy sharing with us about the time when she was an employee.
Well, it was a physicians group that owned Firth, and they'd had a PA in there for just a short period of time, but he hated it because Firth has 450 people in the town. Okay. So Firth is extremely rural and extremely small. And it's only 6 miles from my house in Shelley. And so it was my dream job. But they gave it to this other guy, and I thought, oh, well, so I was looking for another job, and we had I was an infection control nurse in Pocatello for 25 years. And they offered me a job up in Idaho Falls, being a nurse practitioner infection control person. And I was going to interview the next day. And I was on the golf course when they called me and gave me the Firth job. And I was on the 16th hole. I remember. I really golfed good after that because I was so excited. But I got that job. I just barely had graduated. I was brand new nurse practitioner, all by myself in this little town, in this clinic where you can get anything and everything. And they had a doctor up in Shelley that I would meet with once a week. And I had a lot of experience. I have 40 years of experience in healthcare. I started out as a med tech back in 1978. And so I worked in the lab, and then I was an advanced EMT. So it wasn't like if an emergency came in, it wasn't like I was going to panic and croak, but I did a little bit anyway, because I had never been a nurse practitioner. It's way different. But I did know how to start IVs and do all the, get them ready for the ambulance and stuff like that. So, and I had to. There was stuff that came in. You're like,
right. Yeah.
First time I did stitches, a guy got scalped at the potato plant, and I'm like, and luckily I had an MA that was really experienced, and she just kind of walked me through it, and we cleaned it up, stitched it up, and he was fine. And it was like, I still see him. So that was 18 years ago.
And so at this clinic where you started, you were a new grad.
I was brand new, right out of school.
There was nobody there but you.
Nobody.
You were the sole provider. Okay.
Me, an MA, and a receptionist.
Okay. All right. And so then you worked there for a number of years.
I did. I worked there and I built up the practice, and they changed their management. One of the hospitals bought them, and they sent a headhunter, a hatchet man in, and he looked at Firth and said, nah, we don't want to deal with that. And I had been keeping track of the numbers and the amount of money and everything. I knew exactly where we were, but they just didn't want to deal with it, and they were ready to close the clinic. And but they they kind of forgot they had 2 years left on the lease, which would have been about $70,000 in money, in rent. And so I said, listen, let me buy it and I'll save you that money. And, you know, and they could see the smartness of saving that money, but they said, you'll never make it. And that's all they had to say to me was,
Right.
You'll never make it. In fact, I put a thing on Facebook yesterday that said, when somebody tells you can't do it twice and take pictures. I was like, yes. I all they had to do was tell me I wasn't going to make it. And so I scrambled. I went to AAMP, listened to you, got all your tips, got credentialed. And it was weird because, you know, I had to change everything, change my, you know, the ownership of the clinic. And I only missed 13 days of Blue Cross. And that's the only thing that I didn't get in a timely way. And still, that was a lot of money, but it was like Medicaid, Medicare, all of them started on August 1st, 2012. And so I worked hard. I remember needing a little Xanax at the time. Holy crap. But that was almost 10 years ago now, and rest is history. So we've done really well.
Yeah. And you were saying that the practice now, I mean, then it was just you and the MA, and now it's you and some NPs and a whole suite of employees.
12 people. Yeah.
And
everybody lives either in Firth or in Shelley, and it's like a family. It's so cool.
Yeah.
It's awesome. We love each other, and you know, a lot of them have been there for the whole time with me, and just a good feeling. And people will say that, you know, they'll say that, you know, it's the office staff that make it run, you know, make it good.
Right.
It's not necessarily the provider. I try to be a good listener, but the last 2 years I've been out like 6 months on my appointments. And I finally this year had to stop taking new patients in rheumatology because rheumatology is crazy. And I could see that about 7 years ago. I was getting a lot of lupus patients because I have lupus, and they just knew that I related. And so and there's only 2 rheumatologists in all of Southeast Idaho. We're talking like 500,000 people almost, you know, and so it's crazy. They were out a year, and people would come to me and say, I can't, there's no, you know, I need help now.
Right.
So I went and took the advanced rheumatology course through the American College of Rheumatology because I didn't want to be stupid at it.
Right.
And started seeing rheumatology patients.
Okay. So that's how that started. Because the clinic is also family practice. Is that correct?
Yeah. And then Carla and Jake do all my family practice now. And for about 2 years, I've only done rheumatology and been completely booked out.
Yeah, I bet. You know, it's hard, particularly in rural areas, getting into specialists. I mean, when I had first started my practice, I mean, I wasn't a specialist. It was just family practice, although I did have a bent toward pain management. But you know, we lived in a county, the whole county only had 60,000 people. And the town I was in was the largest town, and it had 17,000.
Yeah.
You know, so to send anybody to Seattle, you know, or Tacoma or even Olympia for specialty care, it was difficult.
It was terrible. Yeah.
They hate difficult. Going.
They don't even want to go to Idaho Falls, which is only 20 miles away, but they don't want to go.
No, a lot of people don't want to go into those towns unless they're going in anyway, because that's where they go in and they do their shopping maybe once a month or something like that. But a rural community is so different than practicing in, I suppose, downtown Idaho Falls or downtown Seattle for that matter.
Right.
You know, it's just very different.
Yeah. It's a whole different world.
So with your so you're just doing the rheumatology, everybody else is doing family practice, but you're also you're getting ready to sell your practice. Is that correct?
That's right.
What's going to happen to rheumatology?
That's a big deal.
Okay.
Everybody's very upset. And we haven't really told all my patients yet. So you guys don't talk about it.
Okay, we won't talk about that part then.
We're planning on the first of the year, kind of, we want everybody to have an opportunity to get another provider if they want to, but Jake's been working hard to finish the course, the rheumatology course.
Oh, he is. Okay.
And he's going to take some of the patients, but he can't take everybody. It's just, there's too many. So the hospital in Pocatello, they are our ACO. We've been in an ACO with them for about 6 years, and we have a connection with them. And they're thinking, everybody's saying, what's going to happen? Rheumatology, it's bad now. It's bad with me. And with me leaving, one of the other rheumatologists got very ill, and he was gone almost this whole year. And that I got killed. That's what happened, is we got killed because his patients had nowhere to go for help. And so of course, we're going to help people. We're going to do that. But we need help. Southeast Idaho needs rheumatology help, and somebody's got to start looking at recruiting. And so they want me to help maybe recruit a nurse practitioner to do rheumatology. And but they've only given them 2 half days. They're going to fill that in 5 seconds,
Well, if there's that many patients.
Yeah, if they open it up for rheumatology, the demand is huge. So, I mean, they can make money. At the bottom line is, can we make money doing this? Oh, yeah. I mean, they've looked at this, our clinic. It's been very successful. We could probably get 4 or 5 calls a day of new patients wanting to be scheduled. So somebody can do it.
Perhaps, but if you're getting somebody 2 half days a week, that's not enough to recruit somebody in from the outside.
No. And that's what I told the chief of staff. I said, you need to actually get a rheumatology person, like even a nurse practitioner or PA that has experience in rheumatology. They're not going to come up here for that. They're going to at least want full-time or, part-time. They're going to need to be paid. So we've been looking, and, there's a group called the RAP, which is the Rheumatologists for Advanced Practice Providers. And it's made up of PAs, NPs, and PharmDs. And it's a great group. And so we went to a conference this year, and there's a lot of people out there doing rheumatology that are nurse practitioners. And we'd love to have somebody come up, but
all right. Well, anybody looking, they might just want to contact you after they listen to this podcast.
That'd be great.
And we'll make sure that we have that information available.
Yeah. It's a huge area that needs people, because the people are they're so cool. I mean, and just knowing I have lupus, and I know what it feels like to have chronic pain and fatigue and just feel crappy some days. And usually I feel crappy the same day they do, if the weather's bad or whatever. And I'm like, I walk in, I'm like, I bet you feel crappy today. Yep, I do. So it's good. I love the people, and I could stay forever, probably.
Yeah. Except that, there's also different seasons in our lives, and sometimes it's time to move on. Now, one of the things that I think, especially if anybody's listening that is interested in Idaho is full practice. I mean, that's the beauty of anywhere in Region 10. It is full practice. It is beautiful. It is wide open.
We live in a very, very beautiful place.
Yeah.
It's only an hour and a half from Yellowstone, an hour and a half from Jackson Hole. The Snake River is right there from my house, and it's beautiful. And that's where we live. cross it every day when I go to work and see bald eagles on my way to work. I take pictures of them almost every day, you know, so it's like, it's a great place. It's a beautiful place. I love it here.
Yeah. Yeah. Well, I'm a big fan of the Northwest. I mean, that's where my heart is. So it's a definitely, although I like a little more coastal, but being that close to Yellowstone and the Tetons, that would be the deal.
If you want water, the Yellowstone Lake is really, really big.
Yeah.
It's almost like an ocean. You can't hardly see across it.
There you go. But I'm not going to come take over a practice.
I think we went to Yellowstone 10 times this year, my husband and I.
Yeah. Yeah.
We love it.
Yes, I'm sad to say I've only been once.
Oh my gosh, it's so great.
I know, and there's so much to do, and I know I didn't even touch it hardly.
No, you got to spend a lot of time there.
Yeah.
But since COVID, everybody's discovered
Yeah.
our beautiful places, and
right.
There's too many people.
So speaking of COVID, how did it impact your practice, or did it?
Well, it was interesting because I had a lot of anxiety that I would get it. And so I worried a lot. I worried about my people. We knew we had to stay open, and we just had so many people that needed us and I talked to my staff. I said, you guys, if we stay open, you are, this is at risk. You're at risk for this, and this is bad stuff, and everybody said, no, we want to work with you. We want to stay open. And we did. And what's really funny is I never got COVID. Other people did in my office, and but I just never did. It was weird, but I'm glad. I think Heavenly Father blessed me on that one. So I said a lot of prayer. I did a lot of praying through COVID, and we stayed pretty busy when it was completely quarantined. We still actually stayed pretty busy, and then when the vaccine came out, it was like crazy. We've always been a vaccine, for VFC, for vaccine for children. So we already had a pipeline into that, but there was a tremendous amount of red tape and work that came into qualifying to give the COVID vaccine. And we did it. We did all of the groundwork, and we were the one clinic in Bingham County that they put on the website that said we give COVID vaccines. And there was a pharmacy in Shelley, and that was it. And they put our phone number out there.
Oh my goodness.
And we got like hundreds and hundreds of phone calls. My receptionist, her brain blew up, and we called and said, get that off of there, put our email address, and so they finally did after about 3 days of heck. And that was crazy. And so we were totally inundated. It was a lot of work. I have an MA that she is going to go straight to heaven for all that she did. We vaccinated 2,200 people in our clinic. And that was a lot. And so that was good. And we did probably 2,500 COVID tests, and we're still doing them. And we had a huge surge just recently in Idaho because people aren't getting vaccinated. The fact that we did 2,200 vaccines in Idaho was fantastic. Because Idaho's about 49%. We're always one of the lowest in children's immunizations too. It's just people don't want to do it here.
Yeah.
Well,
where I am right now in Missouri, for a while we were listed as having the least amount, but some other states decided to take that honor.
We got to be close because and they're still in emergency critical. The hospitals are still in critical access right now, and they're having it's still tough. My brother passed away from COVID in January, so that was.
I'm sorry about that.
Yeah, It's been hard. I have people that are sitting there telling me that it doesn't exist.
It's real interesting. I was talking with another nurse practitioner the other day who was speaking at a conference down at the Ozarks. And she said it was like COVID doesn't exist in that area. I said, yeah, I know. It doesn't. And I mean, it does, but the belief
they don't think it does
in this part of the country anyway. And
yeah.
And I mean, we just shake our heads all the time because we don't understand that whole thing, but that's a whole nother topic. So
It's very political.
it's very
Been
political.
tough. Yeah.
And it's also very sad because really we're talking about some basic public health things. And I don't know when health became a political issue. Like,
Well, and I'm an infection controller.
Yes, that's right.
We have always, in our office, we have always been extremely, my master's thesis was on hand hygiene. We just are like Nazis of hand washing, you know?
Yeah.
So our patients know that. And I think they felt pretty comfortable that we changed a few things. We keep them out in the car if they were sick and wear masks and have them wear a mask, bring them in. Just one person would take care of them and things like that, but yeah, it was kind of crazy.
Yeah. Wow. So your clinic though is also known as medical home. Is that correct?
It's a patient-centered medical home, and it's actually the smallest clinic in Idaho. With the patient-centered medical home.
All right. And was that difficult for you to get that designation? And has it made a difference in your practice?
Oh yeah. So we've been recognized now for 3 years in a row, and it's hard to maintain in the fact that once you get your workflow going, it's not really hard to maintain. It's just you have to keep that quality constantly, and everything, all the reimbursement now is based on, value-based care. We just changed I was on a Medicaid committee in the state of Idaho. They just changed our Medicaid to completely value-based care. They're doing VCOs. We have ACOs. We're trying to do, quality. And so if you get a culture in your clinic of quality, and we've got that now. We've got a culture of quality, and so our workflow goes that way, and it makes it a lot easier if you know what's expected. And when you get a new employee, they know, okay, this is how we do it. Then it's not hard. It's not hard, but it's still a lot of paperwork. I have 2 MAs one that just works on that at home. She kind of does all the care gaps and things like that, and tries to close them before the end of the year. So that's a big deal right now, is trying to close all those care gaps right now. So it's crazy.
Okay. So that you can dot all the I's, cross all the T's and stuff like that.
But we've made, that's the way to get your reimbursement. You get your top reimbursement through Medicare, Medicaid. You get your top reimbursement through Blue Cross. You can get an incentive it's really hard because everyone has to do it now, with like an ACO with the group. I know my clinic is doing it, but not all of them are. And so that just like, you're going, come on, you guys.
because it takes everybody to actually get it.
We lose out on that incentive, we leave money on the table because not everybody's made it to that. And it's hard. It's difficult. To get there. It's not like they've given you, just easy peasy stuff. You have to really work at it.
Yeah.
So, and the Medicaid value-based is actually risk. The first year, usually, most of these things, they won't take money from you if you're not doing your quality. So you have your no risk, and then you have the risk. Usually they'll wait for a few years to get everything established, and then they'll throw that risk in on you. But when Medicaid did that this year in Idaho, they threw the risk in there. If you're not doing anything, then you may get, I don't know if they'll do it, but they may fine you at the end of the year.
Mhm.
It's possible. It's
Mhm.
written in, so
Yeah.
we're not getting, I know we're not going to, and we didn't lose anything because we are a patient-centered medical home. They used that to get the top, what's it called? The care you get every month for taking care of people that, anyway, we didn't lose that. We get the
Okay.
top tier of that.
Okay.
And so that was good. And if we didn't do that, if we didn't do patient-centered medical home, we would have been cut quite a bit of money per month. So
Okay. So it made a big difference for you.
does.
So that's great.
Does make a big difference.
So, you were, when we were talking before we started recording, you've been at where you are right now for 19 years. You've owned it for 10 years. And when you were getting started in just transferring over that ownership or purchasing that clinic, what kinds of issues did you come up against? I know you mentioned the credentialing, but what were some of the things, just so that people have an idea of some things maybe to keep their eyes open for, to be aware of if they're in that kind of a situation?
Well, start on Medicare. Get on PICO as soon as possible because it's going to take time.
Yeah.
And you have to understand that the more you mess up, the longer it will take. So be extremely thorough from the very beginning, be anal and OCD on all your credentials. and they've done, since I started, they've got CAQH. Yeah, QH. They've got that. And, they've got some other kind of clearinghouse things for credentialing that make it better. Have your stuff all together, and then you can kind of just go here, here, here. And that's helpful. But I didn't have that. I had to go here, 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 and so you just have to try to figure. And I had no idea how you were reimbursed. I didn't know anything about billing. It was a huge learning cliff. It was tough there for a while. So if I had to do a couple things over, I would have done the tutorials for my billing software first.
Yes.
But I didn't. And I'm not a tutorial person. I just figure I can figure it out. Well, no, not on that. So that's something that I probably would have done a little differently. Couple of other things was the fax machine. I mean, it just seems like a silly thing, but we tried to do a cloud fax. Well, none of your government offices have a cloud. They won't do cloud fax. I didn't know that. And so if they didn't, you just got no information from them. So for a while, for like a month, we weren't able to fax. And we weren't able to get faxes. And it was at a really crucial time. Right? My husband said he remembers me in the fetal position in the hall because the fax machine won't work. So, it's like, keep things simple at first. Keep everything, your overhead, as low as possible. I was telling Barbara, we did an MA, a receptionist, we didn't change that for a couple of years. We kept it pretty simple. Didn't buy a lot of equipment, but what we did do though, is we got equipment that would pay for itself, like an EKG machine, a spirometry. We did those things that we knew would pay for themselves and make money eventually anyway. And they did. All those things we got, they made money for us, so we've always tried to offer as many services as possible. When I became a nurse practitioner, I wanted to do everything. And so it was good because I got in a place where I can do everything. I'm in Idaho. I, have full practice authority from the beginning. We've never had to have a supervising physician. I've been able to own my own clinic without having, one thing I couldn't do here was to be a rural health center because the state of Idaho requires a physician. And so I never did. I didn't become a rural health center, but I am the most rural in this area, but there's like 4 rural health centers around me.
Right.
But I think we've done okay without doing that. I think we've been, in my opinion, better off because I was more autonomous. I didn't have to do a lot of government things.
Right. There are a lot of
I,
regulations with rural health
yeah,
clinics. And actually, I think it's a federal regulation that it's
yeah,
a
they were.
physician's
And
helm.
you had to, the only way you could get qualified as a rural health center was to become Medicare certified, I think. Anyway, they didn't actually do it. They had so many rural health centers that they didn't care to have the people to come in and inspect you. And so it was just kind of a logistics nightmare for me right then. So I thought, oh, this is how we're going to make it be a rural health center, but it didn't turn out that way. So I just got every single thing I could charge for it. We started doing injections, joint injections, and I did training on that. I got trained on everything I could think of to get trained on.
Mhm.
And it worked for us.
Yeah.
And we get a
Yeah.
little bit of everything. I mean, we get gunshot wounds and pigs kicking at you and cows not running over you and car wrecks, and so it's not boring. It's pretty fun.
No,
Yeah.
no. Being in a rural community is not boring because you don't know what's
Always
going
got something new.
Yeah, on the coast, it was usually something, it could be the fishermen, it could be the hunters, it,
Mhm.
could be somebody who got some hypothermia because they were out hiking somewhere,
Yep.
near drownings. I mean, you could just get anything in those
Yeah.
small rural clinics, and not to mention the babies.
Yeah.
So,
We haven't had to deliver one. Oh, knock on wood.
yeah, well, see, you
Probably get
see.
one today. I just
You
jinxed them.
you just might. You just might. So, what else haven't I asked you about your clinic that you would like to talk about, that you'd like to share?
Well, I think a big part of what I do is try to provide access to people,
Mhm.
because they love the fact that we have that clinic there. And then what happened was I got too busy, and then my old patients that had always come to me got mad at me because I was doing this rheumatology and was too busy. But that's when I said, I've got to get somebody good, really good. And I was always a preceptor for nurse practitioner students. And I had these two nurse practitioner students that just, I knew that they were the greatest, and so I've been really, really fortunate to have these two nurse practitioners come and work for me at the clinic. It's been a huge relief for me because I was gonna die. I mean, I was really not good. I was 100 pounds overweight and lupus and trying to see 30 to 35 patients a day by myself. And my husband thought I was going to die. So I lost 90 pounds, which was good.
Yeah.
Got more healthy, which was really good. Got Jake and
And
Carla.
got some NPs on staff with you.
I do. Yeah, I've
Get
got
that
two.
load off.
They're working right now. They're busy. People love them. They're building their practices, with me, and
Yeah.
it's been great.
And they've been with you then for how long?
Jake for almost 4 years.
Okay.
Carla, 3. Yeah.
Yeah, good.
And they
Good.
came right out of school. I grabbed them right out of school,
Yeah.
but I knew them because
Yeah,
I
see,
had
and that's the
precepted
difference. I
them.
think
I knew how
when
good they were.
yeah, and you precept them. I mean, it's like you pre-trained them
I
to come
did.
and
They,
work
they
with you.
and they actually came to my clinic twice in the rotation of their clinicals,
Mhm.
and 1 year and then the next year they both came twice, which was great.
Yeah. Yeah. So it was a no-brainer
I had a
then.
lot of students over the years. Now they're all practicing. It's so fun to watch them,
Yeah.
be great at what they do.
Yeah. Yeah. And the I was talking with another nurse practitioner several episodes ago, and she takes a lot of NP students, and she gets them from all over the country now, because she'll even bring them to her home. And she also
Wow.
does some work in Costa Rica, and students will go with her to Costa Rica as well,
That's awesome.
where they do healthcare. So, there's this investment that, yes, it can be time consuming for a lot of people to have students, especially when they're newer students, but it's also an investment especially if you have your own practice. And in your case, you were able to find the perfect employees to come and work, the perfect clinicians to come and work and grow, and eventually purchase your clinic.
Yeah.
As it turns out. So that's really good.
Yeah.
All right.
It's been good.
This has been great. This has been great.
Been all good.
It's all good. And it's also very good to see you again. I mean, we don't get to talk very much, and
too busy.
And yet we've known of each other and been involved for, well, at least 10 years, if not more. 12. Yeah.
Actually, it was 2012. So I guess 11, something like that. 9, I don't know.
Yeah.
9 years. What is it? 21?
Yeah, whatever. I don't know what year it is.
Yeah. So and you really helped me. I listened. I learned. I was very, very motivated to listen. And I've been a member since you first started the Nurse Practitioner Business Owners Association.
I know. I think you are one of the longest lasting members. There's you and one other nurse practitioner, and I think she's just a year behind you. But from the beginning.
Good. Well, and just the interaction, and if I had a question, I knew I could always go ask, and that I'd get good answers from everybody, and it's been good.
Yeah, good deal. Good deal.
The only thing I hate is this.
I can't help you with that.
No, and I'll be just glad someday to be done with notes.
Yeah. I think that
I'm an old dog. I mean, I'm sure I could get a scribe and it would be easier, but I just got to have that presence with the patient, and I've had a hard time with that.
Yeah. I was always, and still, it's like my notes are so detailed, and it's between that person and I. And personally, as a patient, I don't know if I'm pouring my heart out about something. I don't want a third person listening.
No, and I don't want to have that provider sitting typing on the computer either. So I don't. I write notes a little bit, and then I'd get up at 4 a.m. and do them.
Well, at least you're healthier now, and you're not working 5 days a week.
Yep. And it's all good.
And it's all good. All right. So hopefully anybody who's listening that maybe wants to hang out with you or to contact you about, especially rheumatology. Hello, rheumatology NPs. And actually, I think I referred a rheumatology NP to you, but she wants to start something in Montana.
I've got to get a hold of her too.
Yes,
that's on my list.
She's waiting.
It's on my list of things to do.
I know she's waiting. So, but just your contact information will be in the show notes.
Great.
And your Facebook page, so that they can get a hold of you there.
Great.
All right.
Awesome.
Thank you so much.
All right. Well, thanks, Barbara. That was fun.
It was. Thanks so much for listening, everyone. I'll make sure that I post Katy's information in the area below this video, as well as on our blog at npbusiness.com/podcast. And please remember, leave your comments below and I'll respond to them. And also make sure that you subscribe and like this video. Thanks so much. Bye-bye now.